Let's talk about speaking up for yourself. You may well have suppressed your feelings over the years and look after everybody else, particularly as a wife and mother, someone with a family. But now you need to say what you need. This is the time for you, and the people around you can't know if you don't tell them. So we want to put on a brave face for our family, that's fair enough, but we need to be a bit honest with people. So one of the things I found unbelievable, and even many years ago, 30, 40 years ago when my mother had breast cancer, was that people want to share their experience of cancer, not their own necessarily, but that of people that they've come across or things they've heard or stories on in the newspaper. Most people will have the good sense to tell you a good outcome. That should be really obvious, but it isn't. There are a lot of people actually who get into their subject and then they can't stop themselves, and perhaps they don't even realise that this is actually not a good outcome story. And why are you sharing it with me when I'm going through this and I'm, got fear and trepidation and I don't need that? I actually found that, even years after, if people tell me a sad outcome story, it just sort of, for days, it's going round and round in my head. So tell people around you, take the initiative and say, by the way, if you want to share a cancer story, just make sure it's a good outcome one. Because, if it isn't, it'll only play on my mind. And hopefully then people will have the sense to just talk positively. So the other thing that you need to say, now in my case, I did say, and people were amazing, please don't bring me chocolates. If everybody gives me chocolates, I know I'll eat them, I don't trust myself, and that's not going to do me a lot of good. It's nice to have a bottle of bubbly occasionally, but I didn't really feel like drinking bubbly anyway. So what I would suggest is if people tell your family, they can then tell other people. Flowers. I loved receiving flowers, and I took a photograph of every bouquet that I received from everyone, and I've still got that on my phone because it was just so uplifting and such a beautiful thing, and it's always lovely to have. If there are people who would be prepared to make you a nutritious meal, if you say to them, look, I'm really trying to eat healthily, put lots of vegetables into my body, and I don't want a lot of oil or fat, I'm trying to keep the fat down. If they're prepared to cook you something that ticks the boxes for you, it might be difficult if you're vegetarian and they're not used to cooking it, but if they're willing to try, then that's really helpful. And if you don't need it then and there, if it's freezable, then you can go to it when you need it most. Also, if somebody offers you help to take you to a chemotherapy session or radiotherapy, or to have your tests done before you have your chemo, then take them up on it, if they obviously really mean it. And you'll know if you take them up on it whether they really mean it, because then afterwards they'll say, let me know if you need me to take you again. And that can really help. It takes the burden off whoever your main helper is, or in fact driving yourself like my one friend did, Caroline B. She told me that she drove herself to every chemotherapy session, radiotherapy, and I think she probably got a taxi to bring her back from surgery, but she depended on herself and no one else, but that was because she didn't have a lot of options at the time. But hopefully you have got people that will give you or offer to give you that help. So I said earlier about putting a brave face on for your family, but you know, sometimes you can put too much of a brave face on. I worked through my treatment, but I think my face was so brave, people didn't realise what I was going through. So I put my wig on, which was better than my own hair actually. I put my makeup on and I plastered a smile on my face, went in to work, and I think they just looked at me and thought that I was my normal self. Whereas I was actually feeling really muzzy-headed, really emotional, and it took about a week for me to get back to that fairly normal state. But because I had made myself look normal, they treated me like I was normal. And then you do yourself a disservice, because maybe then you have too much work given to you and you struggle to cope. And then instead of being a distraction and something worthwhile to do to continue working, it can add to your burden and your stress. So I think it's just be honest and speak up. You don't have to be a hero. And if you are struggling, if you have got really quite bad pain, or you know you've got a really sore mouth and you've tried everything and it's not working, ring your oncologist nurse or ring the hospital. Don't just put up with it. And I found this to be true when I was on my second lot of chemotherapy. And I had been told to expect my legs to feel a bit like I'd been to the gym the day before, a bit heavy getting out of bed. But actually the truth was that I had nerve pain, a sort of myalgic pain in my lower back. And I wasn't expecting that. And I wondered what I had done. And actually it got so bad that I was sat downstairs and I couldn't move. And I was throwing things at the television in anger. Tubes of things, I don't know, packets, nothing that would smash. But I was just so angry with this pain that was sort of coming almost in time with my heartbeat. And that nobody told me to expect that that might happen. So I tried various painkillers, managed to get myself into bed, and I stayed put for the next day, because keeping still helped. But I rang the cancer hospital and I spoke to someone there who said, oh yes, what you've got is a myalgia, and it's because the chemotherapy that you're being given is taken from the bark of a tree, and it affects your nerves. So it's obviously triggering off at your lower back and causing the myalgia. And then they told me the tablets that I should get. They faxed through, sounds so old-fashioned now, but they faxed through the prescription to the pharmacy, and my husband went out and got me the tablets. And it was a different combination of paracetamol and codeine that you had to have a prescription for, and that worked for me. My friend that I met at a charity event, Kylie, and who was going through the cancer at the same time as me, she and I were texting each other to say how we were getting on, and I texted her to say, I'm in a lot of pain, I'm really struggling. She said, so am I don't know what to do. And I said, ring the hospital. And she was put on a different pain relief medication, but it worked for her as well. And I was so glad that I'd called, and she was so glad that I told her to call, not just suffer in silence. Because, you know, pain takes a toll on the body, and if you can relieve it, you should, because the body's got a lot of work to do when it's dealing with chemotherapy treatment. So be prepared to speak up kindly and firmly, and let everybody know what you would like, and then they can follow your lead.